A comprehensive ophthalmologist is going to be able to examine patients in the office, deal with medical problems, help people to see, whether it's with glasses, contact lenses, take care of dry eye conditions, conjunctivitis. A surgical ophthalmologist is going to tend to emphasize surgery. If the patient doesn't have a surgical problem, they're not that interested in the patient. I like to consider myself equally divided between medicine and surgery. Being a good diagnostician begins with listening to the patient. The patient comes to you with a problem. They're going to explain what the problem is, what it is, how it's bothering them. You have to listen. Based on what they're telling you, then you can ask some pertinent questions, which will draw out more information. And oftentimes, by eliciting the proper history from the patient, you can almost arrive at the diagnosis before performing the clinical exam. A 5-year-old exam would be primarily directed toward detecting and screening for amblyopia, which is also known as lazy eye. This is important because at that age group, a child could have poor vision in one eye, which could go undetected, unnoticed, and unless it is found at that time and treated properly, the potential for that child to see 20/20 in both eyes could be lost forever. At age 40, it's important to check for glaucoma. The incidence for glaucoma in adults age 40 and over is 1 in 100. In addition to that, glaucoma oftentimes, 95% of the time, has no symptoms. So a lot of damage could be done over the years without the individual knowing it. Glaucoma is, as far as we can understand at this time, high pressure inside the eye, which over time destroys the optic nerve in a permanent way. At 60, I begin to look for early signs, possible signs of macular degeneration. A dilated pupil, a careful look at the macula will sometimes show subtle changes in the macula. This would be the time to discuss with the patient the risk factors for macular degeneration. Macular degeneration can run in families, so there's a genetic predisposition. Uncontrolled blood pressure is a risk. High cholesterol is a risk. Smoking cigarettes is a risk. Excessive exposure to the ultraviolet from the sun is a risk. Poor nutrition is a risk. Cataracts are changes in the natural lens behind the pupil, which ultimately results in its lack of clarity. The lens becomes cloudier, and the cloudy lens we call a cataract. These days, with cataract surgery and the way it's evolved, a lot of patients are being encouraged to have surgery early, okay? And that's much different from years ago. I'm not against early cataract surgery, but the patient doesn't need to be told that it has to be done. So my philosophy with regard to cataract surgery includes doing an exam to determine that the patient actually has a cataract. And you'd be surprised sometimes they don't, okay? But most of the time they have a legitimate cataract. Next, the patient has to have symptoms. Glare when they're driving at night, loss of depth perception, overall dimming of the vision, something that affects the quality of their lives. And lastly, I like to ask the patient, do you feel you need to see better? Are you missing out? Do you want surgery? If they say no, I say, we're done. You don't need surgery. LASIK is a procedure whereby the laser is used to reshape the cornea in front of the eye, in front of the pupil. If the shaping of the cornea is done in such a way that nearsightedness is eliminated or farsightedness is eliminated, that individual won't need glasses until sometime after 40 when presbyopia kicks in and they need to have reading glasses. I think that my approach to ophthalmology is such that my candor and frankness and actually looking out for the patient's best interest is what sets me apart. I will tell people they don't need cataract surgery. I've told people that they can wait. And those same people 2 weeks later will say, oh, I thought it over, I'm ready. So that means a lot to me, that I've told them they don't have to have the surgery. They decide for themselves because they want it. That's when I like to do it.